Okay, so we are group 9, and this is our role play session on patient audio visual aspects of speech, also known as speech reading with the cochlear implant patient.
Hi, everyone. This is Kendall Myers, and I'm playing the speech language pathologist in our group.
This is Caitlin Abrams, and I'll be playing the audiologist.
This is Hadley, and I'll be playing the cochlear implant patient.
And this is Haley, and I'll be playing the grandchild who is advocating for the patient. Okay, to provide some background information for this role play, Hadley is a 75-year-old female with a profound hearing loss due to her previous loud work environment. Hadley expressed that her hearing began to decline around the age of 35 and has worsened throughout the years. Hadley just received a cochlear implant a little less than a year ago. She is attending this appointment with her grandchild, Haley, who is advocating for her as she continues to work with her cochlear implant. Hadley is having trouble understanding speech in the higher frequencies. The SLP and audiologist discuss Hadley's plan and adjustment to the cochlear implant while also trying to work with her to improve speech reading skills throughout this session. This is the second appointment with the audiologist and the SLP collaboratively working on oral rehabilitation.
Hi, Dr. Caitlin. It is nice to be working with you again today. So I see we have Miss Hadley joining us for her appointment today to talk to us about how she's managing her cochlear implant and how she is able to understand speech now.
Yes, so she has had her implant for a little less than a year, and she mentioned in the previous appointment that she is having some trouble with actually understanding speech.
I understand. Well, I have an idea for helping Miss Hadley out with being able to recognize speech. We could introduce the concept of speech reading to her because I do remember her trying or mentioning that she had tried to lip read before.
Sounds like a great idea. Let's go ahead and let Miss Hadley in so we can go ahead and start the appointment.
Sounds good.
Hi, how are you guys today?
Hello.
Hi, we're doing very well. I hope you are too, Mrs. Hadley.
I am. I'm very excited.
Miss Hadley, so I see that your grandchild is accompanying you today. May I ask why you felt it was best for her to be at this appointment with you?
Well, I've had a hard time recognizing where I'm still having trouble with my hearing. Experience, my granddaughter spends the most time with me out of anyone, so I felt like her coming along would make this appointment a bit more beneficial because she may be able to better explain my current hearing characteristics because, I'm having a bit of trouble with it.
Well, Miss Haley, can you tell me a little bit about what you think your grandmother may be still struggling with hearing wise? Does she have a fairly easy time communicating with your siblings or your parents?
For the most part, I think she seems to be more understanding and included in most conversations with like older adults and older family members. However, when we go over to her house on Sunday nights for dinner and card games like we usually do, I've noticed that she hasn't been recognizing and understanding what my younger sister and younger cousins say. She seems to just smile and nod at the conversation and doesn't really add anything to the conversation. So that kind of gave me the impression that she wasn't understanding and picking up on the speech. I feel bad for her because I don't want her to miss out on conversation, especially with like her family members.
Yeah, I understand. So, Miss Hadley, do you think it's fair to say that you've been having a difficult time still hearing your younger grandchildren?
Yes, ma'am, I do. It's very hard, especially because after about a year of my cochlear implant, the robotic tone dispersed, and that did warm my heart to hear their voices in a normal tone again. I didn't think I would still struggle to understand the younger ones, especially since I've received the implant. However, I do find myself trying to watch their lips to pick up on what the younger children are saying, but it just does not feel like it's ever enough.
Yeah, I can kind of agree with what my grandmother said. We were happy to hear that her robotic tone had went away since the initial concern with the cochlear implant, but now we're worried about her still having difficulty with understanding speech and higher frequencies, such as like the younger children in the family, and we kind of wanted to know if there's something that we can do to further work on this issue.
I understand. So, Miss Hadley, when you're watching your grandchildren speak, do you only watch their lips for information on what they're saying?
Well, yes, I've just been trying to learn how to read their lips because I felt like that was the best thing to do.
Okay. Have you ever used body language or gestures to help you understand what your grandchildren might be saying, or just reading lips?
I don't necessarily pay too much attention to those kinds of details. I mainly do just look at their lips.
I've noticed that when she tries to lip read, she only picks up on about 20% of what is being said, so she isn't able to pick up on the whole conversation, and she's missing those key pieces to the conversations, or she sometimes misreads what's being said and ends up having a total different meaning of the conversation.
Well, we have an idea for you, Miss Hadley. Dr. Caitlin and I discussed that speech reading could be very beneficial for you instead of solely relying on lip reading.
Oh, can I ask what the difference between what I've been doing, trying to read lips, is in regards to the idea of speech reading?
Yeah, so the difference between lip reading and speech reading is when you lip read, you are focused more on the lips, and that can be difficult because there are so many speech sounds that are similar to each other, and some speech sounds are just not visible. They can be hard to differentiate when just reading the lips, and with speech reading, you pay more attention to the facial features, body gestures, and the situation.
Yes, that's exactly right. And since you've been having some trouble understanding some of your younger children due to their higher pitched voices, this technique can really help you figure out what they're discussing when they're talking to you. Children also tend to be very expressive, which can be very helpful when you're using speech reading. So, speech reading, the brain is just going to combine the sounds that you hear with those facial movements and expressions that you're able to recognize.
That sounds great. I think that would be very beneficial for my grandmother to learn.
Yes, that seems like it'll be very helpful for the situation. Can I ask, are there any factors that can prohibit my ability to speech read? Or are there any tips for successful speech reading on how to start that process of learning it?
Yeah, so for speech reading, that technique can be affected by who is talking and what they're saying. For example, the talker could have an accent that can affect how you're used to seeing the mouth move for speech sounds.
Also, your environment around you and the speaker can also prohibit your ability to speech read.
Mhm.
So, a noisy environment where you have people walking between you and the speaker is definitely going to cause some difficulty. But you don't have to worry, Miss Hadley, because we're going to help you learn this technique.
That sounds perfect. I'm very excited to learn it.
Okay, Miss Hadley, we're going to start with an exercise that's supposed to help you start training your brain and your eyes for speech reading.
Also, remember to use any technique that makes you successful in lip reading combined with looking at Dr. Caitlin's movement of her facial features and her gestures.
Hadley, are you ready? We're going to practice some speech reading. So, since eye training is a bit more difficult and this is your first session with speech reading, this exercise I'm going to teach you how to do is going to be some brain training. So, the way this exercise works is I'm going to read you some sentences. Each sentence, I'm going to leave a blank of a missing word, and I want you to guess what the word is based on the context of the sentence. So, the purpose of this exercise is to help you learn how to use the context of the words that you did hear to help you make inferences about the words that you didn't hear. You can also use visual cues from my facial expressions or any gestures I might make to help you. Do you have any questions about the exercise before we start?
No, I think I understand. Let's get to it.
Wonderful. Okay, so these first few sentences are going to be fairly easy, just so you can get used to the exercise. Okay, are you ready?
Yes, ma'am.
The sky is
Blue,
great. Okay, next sentence. The earth is
round,
Wonderful. All right, let's do one more. Grass is
Green.
wonderful job. All right, Miss Hadley, now I'm going to say a few sentences that you might use at home while you're watching TV with your husband. And I want you to just do the same thing we just did.
Okay.
Can you pass me the
Remote.
wonderful? Do you mind if I change the
Channel.
wait? Okay. TV's really loud. Can you turn down the
Volume.
great job? So, are you able to see how the exercise is training your brain to think about context in order to figure out those missing words?
Yes, I've never really thought about using context parts of the spoken message that I've been given to help me figure out the parts that I've missed. It might be because I put so much energy and concentration to just reading the lips when it's hard for me to hear, which just distracts me from focusing on the sounds that I can hear.
You're exactly right, Miss Hadley. And lip reading requires you to use your vision more so than your hearing, which might make it harder to understand what the person is saying. On top of this, there are many factors that make lip reading hard. In fact, 60% of speech sounds are not easily visible. So this makes reading lips super difficult. When you use speech reading, you're using visual cues along with the sounds you are able to hear to help you understand the conversation.
Sorry, I don't know how to work this technology. Wow, I would have never thought that lip reading might make it more difficult to understand speech, but I'm so glad that you've introduced me to speech reading because I think it's going to be really helpful.
Yes, we think so too, Miss Hadley. So now that we've discussed speech reading and introduced a new exercise to help train your brain for speech reading, we'd like for you to take what you've learned in this session and practice it at home. So also, while you're practicing, try working on using your vision to look at gestures and facial expressions instead of just looking at the lips solely. This may this may give you a better idea about the verbal message.
I feel like that sounds simple enough.
Before we end the session, there are a few more things I want to touch on in regards to speech reading. So since you are new to the idea of speech reading, it will take a little bit of time and practice to improve your ability to speech read. It's okay if you aren't able to understand everything at first. The more practice and experience you have, the more improvement you will see. It's also important that you keep yourself motivated and be confident in your abilities. This is going to help you progress faster and make you more willing to put in the work to get better.
I would definitely make sure to help her practice at home with her speech reading skills and keep her motivated. I've seen how much my grandmother struggles by only trying to read lips, so I'm eager to see how speech reading will help her understand the whole conversation and pick up on the whole context of the conversation.
Yes,
Mm-hmm.
I think Miss Hadley is definitely going to see results by using these techniques we've been discussing. Just remember to maximize the use of those verbal cues and try and relate them to nonverbal cues, such as facial expressions, gestures, the situation that you're having the conversation in. That really helps. And also, don't hesitate to be assertive and ask questions if you're having trouble understanding speech. All right, so do you have any questions or concerns?
No, I don't think I do. Thank you so much. I'm so excited to start using speech reading and working towards understanding my younger grandchildren.
This has been so helpful, and I can't wait to watch her progress throughout this process. Thank y'all.
You are very welcome. At our next session, we will assess any progress you've had using speech reading, and we'll go from there.
That sounds great. Have a wonderful rest of your day. Thank you.
Have a great day, guys.
Y'all as well.